Hello, students. We will be discussing now the control of communicable diseases. When you say communicable diseases, these are illnesses that are caused by an infectious agent or its toxic products that are transmitted directly or indirectly to a person, animal, or an intermediary host or inanimate environment. Communicable diseases are among the top 10 leading causes of morbidity in the country. We have this what we call as epidemiological triangle model. We have the three factors that are components of communicable disease. These are namely the agent, the host, and the environment. So when we say agent, this is the organism involved in the development of disease. So this is the agent is the organism that has to be present for an infection to happen. So this could either be a bacteria, a virus, a fungus, or protozoa, or helminths, or arthropods. So this could also be as well not only the causative agent as well as this could be as well act as vector. No, we have aside from the agents, we have what we call as vectors to these agents where um, they act as the reservoir before they are being transmitted to the host, or in this case, we have the human body or us, the human beings. So the host is where the infection or the disease occurs. So the host is any organism that harbors and provides nutrition for the agent so that the agent will multiply in the body of the host. Okay, so um, until such time that it will cause signs and symptoms to be manifested. So what happens to the host? So the host is actually um, influenced. That could be influenced. The state of the host could be influenced by many factors. In our cases, as humans, we are influenced by our age. Like for example, very young children are very vulnerable to develop communicable diseases, as well as we have older adults or the senior citizens. We have gender. Specifically, there are communicable diseases that are commonly found in female than in male, as well as socioeconomic status. We would have known by now that those belonging to the lower socioeconomic level are more prone to um, communicable diseases because most often than not, their health is not that supported. That brings us to the practices like their nutrition, their hygiene, as well as their behavior. The third factor or component is the environment. So when we say environment, this is the condition in which the agent may exist, survive, or originate. It could be physical, biological, and socio-economic component. So this includes the environment could be the temperature, the weather, the soil, the water, the food sources. And it could also be as well as animals, insects, flora, or other human beings that could act as reservoir, or they enable the survival of these organisms. So it is very important to take note of this epidemiological triangle model. We have the three components. So to address communicable diseases, we have to know for specific communicable diseases, we have to know the agent, the host, and the type of environment that where these agents flourish. For us to address this, we need as well to know the chain of infection. Okay, so it is as well very important for us to be familiar with the chain of infection. This is important, especially for us who works with the community as a public health nurse or a community health nurse. But when we are talking about the chain of infection, this refers to the sequence of factors that are essential or should be present now for the development of a specific communicable disease. So as you can see, it looks like a chain. So to be able to stop communicable disease at the communicable disease on its track, we can either what you call as break the chain in any of the portion of this chain. So we have the infectious agent or the causative agent. We have the reservoir. We have the portal of exit. We have the mode of transmission, portal of entry, as well as the susceptible host. Now, with regards to the causative agent or the infectious agent, so we have discussed a while ago, or I'm sure most of you are familiar or knows this already, that they are the organism capable of producing the disease. As I have said, this could be a bacteria, a virus, fungus, or a helminth, or a parasite. Basically, the agent interacts with its host in several ways. How does this interact with the host? So when I say the host, that refers to where this agent can multiply and cause infection, cause the infection. So in this case, you're talking about our body. We have what they call as the pathogenicity. This is the ability of this infectious or causative agent to produce the disease in those infected with the agent. We also have these terms as infectivity, which is the ability of this agent to infect large number of people. If ever you have heard the word virulence, that refers to the ability of this agent to produce disease in those affected. Okay, so this is about our infectious agent. So what about the reservoir? So when we say reservoir, we are referring to the environment or the object wherein this organism or this agent multiplies, no, or survives. So it could be a human being, an animal, a plant, or it could be in the water, in the soil, or it could be an inanimate object. So from this infectious agent or causative agent would have to need a reservoir. So this reservoir is where they could multiply or they survive. And then after that, if they are within this reservoir, they would have to look, no, or they would have to know the portal of exit. So this is where the causative agent leaves its reservoir. So in human beings, in our bodies, the portal of exit of the infectious agents could be our respiratory system, our genitourinary, it could be our skin, or it could be our gastrointestinal tract. Once the reservoir, okay, the reservoir would be here, and it is the organism, the causative agent is able to multiply in here. It will have to exit the reservoir to be able to be transferred to the host. Okay, so for if you're a human being that is considered as a reservoir, you harbor that causative agent, like for example tuberculosis. So you can transmit tuberculosis. The portal of exit of this the causative agent for tuberculosis would be your respiratory system. Okay, so it would have to exit through your mouth, through your nose. So when you cough and you don't cover it, so it will exit. And not only that, we would have to take note as well with the mode of transmission. So when we say the mode of transmission, it is the means by which the agent passes from the portal of exit in the reservoir to the susceptible host. So, like for example, Mycobacterium tuberculosis, we have this Mycobacterium tuberculosis in the human host, so that's where the this infectious agent is being has the environment to multiply, and then through our nose and mouth it will exit, and then we will have the mode of transmission. So that is the method of how the agent was able to exit. So like for example, tuberculosis, it could be through airborne or droplet. Okay, so we have several concepts here. We have contact. So when you say contact, that means direct contact transmission. Like for example, we kiss someone who is infected with something. Like for example, COVID-19. If a person has COVID-19 and we are in close physical contact, so we could be infected. The mode of transmission could be direct or indirect contact. Direct contact, person to person. Indirect contact, so it could be that the organism got out of the reservoir, and then it lodged into an inanimate object, and then another person touched that inanimate object. That could be considered as contact, indirect though. We have as well vector. So when I say vector, this is the organism wherein the bacteria or the agent is using to be transmitted to the host. So like for example, we have mosquitoes. So mosquitoes has to be the vector of what we call as the dengue mosquito, dengue disease or fever, or the malaria. So the vector is the mosquito. So from like the reservoir, it will have to exit, and then it will have to be transmitted through the mode of transmission. So that's through a vector. So it doesn't go directly to the host, but it is passed on by another organism. We also have these vehicles. So when you say vehicle transmission, this occurs when these agents are present in inanimate objects. So kumbaga they are um, carried into our bodies or transported into our bodies through vehicle transmission. Like for example, we ate contaminated food. So the contaminated food is the vehicle. Or for example, we 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 were able to consume something that's contaminated with um, feces or vomitus of infected individual, then the transmission will be considered as vehicle transmission. We have also transmission through airborne, and we have the droplet transmission. So what's the difference of the two? So vehicle droplet transmission occurs when disease-causing agents that is present in residues of fluid from the infected individual travels in the air through sneezing, coughing, or just by breathing, but it travels less than 3 feet, within 3 feet from the infected individual. Airborne transmission, on the other hand, is the same thing, but these particles from the infected individual travels longer than 3 feet. Okay, so when we say airborne, usually this particles from the infected host or from the host are usually very tiny, tinier than those through the droplet because they're able to travel farther than 3 feet. Okay, so the portal of entry is where an agent invades the host. So like for example, let's go back to our example of tuberculosis. Usually the portal of exit is usually the portal of entry also. So like for example, TB, sabi natin, it exits from the reservoir or that another infected person through the mouth and the nose, okay, and is transmitted through airborne and droplet transmission, and it gets into the body of a susceptible host through its respiratory portals as well. Okay, and then from there, the organism or the infectious agent or the causative agent is now able to enter the body of this susceptible host. So when we say susceptible host, we are referring to, like for example, your characteristic or your susceptibility, because well, not everyone who are exposed to an infectious agent develop the disease. So it would be a matter of being susceptible to that condition. So again, we have the different factors that could affect the host, which are like age, gender, nutritional status, socioeconomic status. So all of these factors could affect your susceptibility to develop the disease through this infectious or causative agent. So as a public health nurse, these are the functions, especially when it comes to communicable diseases. So several of these communicable diseases are categorized as notifiable diseases. That means if we see them in our practice as PHNs, we have to report them. So we have this list from this control or reporting of notifiable diseases in the country, the Republic Act 11332. So that includes dengue, encephalitis, and all of these diseases. So I'd like you to study what are those notifiable diseases. So, as well as when we encounter a specific notifiable disease, we refer the patient to the nearest health facility that is capable of taking care of the client with such condition. We as well initiate health education drive towards prevention of outbreaks in communities. So prevention, as we have studied, is the best way to combat any health condition. So, with regards to communicable diseases, prevention, it cannot be emphasized. We as well assist in the diagnosis of potential cases of communicable disease based on the signs and symptoms. So like for example, dengue, if we have a patient in a community that is experiencing fever for more than 24 hours already, then we assist the family to seek diagnostic or laboratory examinations basing on the signs and symptoms to rule out dengue. As well as we have said, we can conduct as well epidemiological investigations together with the rest of the public health team during an outbreak. So when you say epidemiological investigation, we would like to know and find out what are the factors that could have led to a specific outbreak. So is it low utilization of services? So this usually happens when it comes to like the outbreaks of childhood diseases that are already addressed through the national immunization program, as well as we can conduct as well if, like for example, is this a new occurrence or is this just a recurrence of something that was not taken care of? So that is also as our part. We are as well investigators, especially during an outbreak. So the discussion of the succeeding or the following diseases would be just a review. So I will not be discussing everything about each disease. I will take it upon you to review, especially on specific causative agents or agent for each communicable disease. I would like you to review as well the specific mode of transmission, the incubation period, the signs and symptoms, the laboratory and diagnostic exams, the management and treatment, as well as the prevention and control. So I would also like you to take note of the drug of choice when it comes to treating these diseases. On top of the list is tuberculosis. Tuberculosis is one of the oldest and the deadliest diseases worldwide. In our country, the TB had always been one of the leading causes of morbidity. As you all know, TB is highly prevalent in our country, but we have the National Tuberculosis Control Program, or what you call as the NTP, which was designed with a vision for a drug or a TB-free Philippines. And this NTP is to manage the overall program in the country when it comes to tuberculosis. We also have the directly observed treatment short course or DOTS, which is incorporated as part of the strategy under the National Tuberculosis Control Program, which is believed to be the most effective strategy in controlling tuberculosis. So as a nurse, our responsibility in implementing NTP and the DOT strategy is to be the administrator. We act as the one to manage the procedures for case finding. Together with the rest of the healthcare team, we assign and supervise a treatment partner for patients, because directly observed treatment short course would mean that the treatment regimen of a TB positive patient would have to have another person to observe it. Like for example, every time the person takes his or her medications, which is usually daily, would have to be observed and recorded by another person. So it could be you, or it could be another member of the healthcare team, or it could be a trusted member or leader of the community. So many other things like supervising our rural health midwives to ensure as well the implementation of the DOTS. We are also in charge of updating and maintaining the NTP register. So we have a lot of roles to do when it comes to being an administrator. The next is nurses. We could act as a health educator. We know that one of the most effective way to prevent a disease is to educate the community. So that would be our role as well. As a case manager and a coordinator, we are considered the one who leads, of course, the team in the RHU together with the physician. Okay, so we have here different ways to manage tuberculosis, but we have specific, in the community, we have specific treatment regimen. So I would like you to as well be familiar with how it is to us as public health nurses. Another one that's not anymore as common in the community as before is leprosy. Tuberculosis and leprosy have causative agents that are both mycobacterium, or we call them as gram-negative bacteria. So tuberculosis usually affects the respiratory system, while leprosy actually would be manifested initially through the integument. So you can see there, usually leprosy presents itself originally in the early signs or the early stages of the disease. It would present as a reddish or whitish change in skin color. Usually this is coupled with a loss of sensation, loss of or decrease in sweating and hair growth. And then eventually it would develop into loss of eyebrows, inability to close lids. So I would like you to study these two diseases as well. We have vector-borne diseases. One of the most common vectors are mosquitoes, right? So we have this dengue, we have malaria. So when we say dengue, this is a disease caused by the by mosquito within the Aedes family. So when you say usually dengue and malaria, the vector would be the female. For dengue, the female Aedes mosquito. So this could harbor the dengue virus, which when they have it, the female Aedes mosquito, when they harbor the virus, then when they bite humans, then they can transmit the disease. So this is transmitted through mosquito bites. We have different classification of dengue. By the way, dengue, although it's caused by a virus, has I think it has 4 different strains. Although you can get uh, immunity, but since there are 4 strains of the virus, you will never know. If say you had dengue before, you still have to be careful because there are 4 strains of the virus. So you have to be very careful as well, even if you had an experience with dengue already. So for malaria, for dengue, let's discuss dengue a little bit. So there are different phases of illness of dengue, no? First, we have the febrile phase, which usually lasts up to 7 days. So febrile phase, there is fever and other signs like when maybe some of you had experienced dengue already, so you would know that this is not a typical fever, this is not a typical body malaise, this is the typical headache. So this is some kind of very severe, like body pains and all. Sometimes there is vomiting. So the fever is high grade. And some would have sore throat and other accompanying infections, but the nausea and vomiting is a little bit something like just like the usual, not like the usual that we feel. So after the febrile phase, we have the critical phase. This lasts for 24 to 48 hours when this starts when the fever breaks, or when the body temperature drops or goes back to the normal temperature. But this is a critical phase because it is at this point that there is an increase in capillary permeability. So it is at this point, it's called critical because there could be a rapid decrease in platelet count, which could cause in shift, no, of the fluids. We have this what they would call as, you could have what you call as internal bleeding or hemorrhage. So it could be internally or it could be obvious. Once the patient is able to survive the critical phase, then the recovery phase commences. So this would mean that after the critical phase, 2 to 7 days, and then usually it's 5 days. On the 5th day, on the 5th day of fever, we expect the client's temperature to drop. So the client will not have fever anymore, but since it's a critical phase, it's very important for us to prepare for that phase. And then after that 24 to 48 hours, then it will now be the recovery phase. The client will start to feel better, a lot better than the previous days. So the appetite starts to improve as well as the other signs subside. So there is no specific drug treatment for dengue since this is caused by a virus. Okay, so what we can do is to ensure that your client is kept well hydrated all throughout the course of the disease, because we don't want the dehydration to occur, because it can also cause a shift, no, in our interstitial fluid. We have as well malaria, which is also caused by a bite from mosquito. What causes malaria is actually a protozoa. Now that is carried by the female, no, through a bite from a female Anopheles mosquito. Malaria is endemic in several areas in our country, specifically Palawan and Mindoro. So the drug of choice for the treatment usually is chloroquine. Okay. What else? Yeah, I think that's it. So I hope you will study more about malaria. We have filariasis. Filariasis is as well caused by um, by an organism which we called as Wuchereria bancrofti. We have as well Brugia malayi. So these organisms are transmitted to us through the bite of a mosquito carrier or vector. So what happens here is, aside from the signs of infection such as fever, chills, body pains, we have this what we call as the gradual thickening of the skin. Okay, if you can observe in the picture, there's a gradual until such picture or manifestation would be like that, because aside from the gradual thickening of the skin, we also have lymphangitis, and this usually occurs in the limbs, in the scrotum. Okay, so this is what we call as elephantiasis. Elephantiasis is the enlargement because there is blockage in the lymphatic system of this extremity or affected area. Now we have this typhoid fever, dysentery, cholera. We consider this as what we call as waterborne diseases. That means they are transmitted to us by through ingestion of contaminated food or water, no, with feces or urine of infected individuals. That's why they are called waterborne diseases. We also have measles, rubella, chickenpox, and poliomyelitis. So I hope you will realize that these diseases are part of the what you call as the common childhood diseases, and they are part of our national immunization program. So we should not be, no, by theory, we should not be seeing them or severe cases of them anymore, no, especially measles and polio. Okay, so they are measles, mumps, rubella, or German measles, and chickenpox are caused by a virus. While poliomyelitis is also caused by a virus. So please study their presenting signs as well as the other characteristics of these childhood or common childhood diseases. Okay, we have as well as cariasis, enterobiasis, schistosomiasis. These are what we call common parasitic infections in our country. Okay. We also have diseases that are categorized or called zoonosis or zoonotic diseases. That means they are diseases and infections that are transmitted to us, okay, from vertebrate, okay? So the agent could either be a virus or bacteria. So when we say rabies, this is caused by a virus, rhabdovirus, that is transmitted to us by a vector, a vertebrate vector. Commonly, we have dogs and cats. So if you are bitten by a rabid dog or cat or a rabid animal, then it could transmit the virus to us. So they are called zoonosis because they could be transferred to us from vertebrate or from animals. Kindly go over what are the different characteristics of rabies. We have as well leptospirosis, okay, and scabies. Okay, these diseases, gonorrhea, syphilis, chlamydia, genital herpes, genital warts, HIV/AIDS are, what do we call them? They are sexually transmitted infections or STI, which means that most of the time they are transmitted to us through sexual contact, okay? HIV/AIDS is as well transmitted through us through sexual contact and more. It could be also transmitted to us because this is what we call as found in blood and specific body fluids, semen and vaginal discharges. So it could also be transmitted through blood transfusion, sharing of contaminated syringes, and needles and blades as well. Okay, so HIV/AIDS is an emerging concern right now for the country because we have one of the fastest increase in the incidences and prevalence of HIV/AIDS. Okay, we have as well what we call as emerging infectious diseases. So when I say emerging, they had been identified not for so long already, and at the same time they are concerns as well. So when I say emerging infectious diseases, so these are diseases that had recently been identified. So we have the severe acute respiratory syndrome or the SARS. We have as well the MERS-CoV or the Middle East Respiratory Syndrome coronavirus. We have the avian flu, which is also caused by a virus. So most commonly by H5N1. And then we have the hand, foot, and mouth disease. And then recently we have this COVID-19 or the corona virus disease 2019. So kindly go over that because this is just a review. Okay, that's it, students. So don't forget to study more about the communicable diseases mentioned, to review more on their characteristics. Thank you.